Hello, Breathe Less community. I'd like to introduce to you today Fred Brown, who's one of the Breathing Center's top specialists. Thanks, Fred, for taking the time to talk to us today about COVID-19.
Yes, it's my pleasure. How are you doing today?
Good.
Good.
So for starters, do you want to tell us a little bit about the work that you do in case anybody watching has not yet met you?
Absolutely, absolutely. Thanks for that introduction. Well, I've been a respiratory therapist for about the past 25, 26 years. And whether you call it fortunate or unfortunate, I was pretty much in the height of COVID-19 when it broke out, working in a New York hospital and having that experience of seeing COVID start with just a few patients and then mushroom into multiple patients coming in with this newfound virus. And let me tell you, it was an educational experience all within itself, from the smallest person in the hospital, janitorial, all the way to the big ups. Everyone, time and time again, stated that this was a historic time never experienced in anyone's lifetime. And so it was truly educational, emotional, as well as just a ton of opportunities to serve in a way that in my lifetime, in my career, I never thought that it would occur. And that's pretty much the sentiment that many in the hospitals have experienced, and so I'd say that initially gives me a little bit of experience than the average person when dealing with COVID, which is why I like to take that experience, and pass it on. Combined with what I think is even more important and just as historic is being able to see how the Buteyko breathing method can actually have an impact and relate to COVID-19.
So you're a respiratory therapist and a Buteyko Breathing Specialist, which I think is a fascinating combination. So as of today, now that it's in October 2020, are you still currently working with COVID patients?
Yes. In fact, each and every day that I go to work, usually we're still having to manage COVID patients. The volume is significantly less, but still we do have individuals who are coming down with it and who are some experiencing critical problems, and others that are experiencing COVID, have COVID, getting better and leaving. But the volume is tremendously less. But yes, we are still having to deal with it at the present time.
What are some of your key observations now being months working with COVID patients?
I would say one is the importance of oxygenation. It's really what we've learned is that it's a disease that's really mainly an oxygenation problem. And so when you think of from the Buteyko method standpoint, that's one of the things that we highlight on as far as educating people how to maximize the uptake of their oxygen and improve their overall health through that method, which on the upcoming webinar, we'll be talking about in further detail and sharing some examples of things that an individual can do for prevention if you don't have it, and for increased recovery if you do. That'll be what I'll be looking to share in the up and coming webinar.
What are your personal thoughts on COVID? Do you think that it's going away anytime soon, or what are your thoughts on that?
Well, I think no one can foretell the future, so I really don't know which way it would go. So I don't have really a kind of like a prophecy, so to speak. I think many people who jump on that bandwagon usually wind up with pie in their face. But with that said, I don't think that it really matters what transitions in the near future, because if you're doing what you need to do, which most people don't, most people do not address their breathing problems or even know how to improve their breathing for their own protection. So whether COVID is around or not around, something else will be around. It may not be COVID-19, it may be COVID-25. I mean, who knows? But what I would say is that COVID-19, I believe, has helped people to really recognize the importance of their own health, the importance of prevention. It has really brought that to the forefront. And that's what I love about what we do, is that the methods and the Buteyko method that we do speak on is one of the most, I've found, the most important tools that one can use to actually do that, to help prevent, help improve, and also help to improve your immune system, so that way you can have better protection no matter if COVID is here or not, because we're in a world that is hostile to our overall health. It's just the times that we're living now, it's been heightened and magnified. And I think rightfully so, because with that, people will begin to start to wake up and not wait until it's too late, but address things beforehand, or even have their knowledge of what to do for their loved ones, for the people that they may care about, that they know may have some pre-existing issues, which is another thing I'll speak about that is a key component that we also realized in this event during these historic times.
So as far as working in the hospital, you have a very unique perspective, since your formal professional training as a respiratory therapist, and then also your training as a Buteyko Breathing Specialist. And I assume when you're working as a respiratory therapist at the hospital, you are wearing that hat. Has the two ever overcrossed each other in the work? I'm assuming only there's certain boundaries that you would be able to legally and professionally do, but has there ever been some overlap from the Buteyko side to the respiratory therapy side?
Definitely. Some of the things that we've been trained as a Buteyko therapist, we not only saw them utilizing in the hospital to address certain issues, which I'll speak to, about, as far as positioning in the hospital bed. So some direct principles that we've learned, I saw from my own eyes that they started to implement. And it was very interesting, because of my training, I understood why it was working, whereas many times it was just really a shot in the dark for those in the hospital setting. So that was a fairly nice benefit of the Buteyko training, to see why something is working and also how to accentuate it given the situation and circumstance. Also, ventilator management, which I'll share some examples, which I saw clearly some principles of less breathing having some tremendous impact in some of the direct care that I was able to give. And that was not only giving me a sense of satisfaction, but also gave me a sense of awareness that, wow, this stuff really does work. And if it works with the sickest patients among it, it kind of, for me, elevated my level of belief, because if it's working with those who are the sickest, those who are hanging on, you know, the very, thread of life, how much more those who I also see in my practice and working with people, seeing that same type of turnaround with some of the health issues that people are being challenged with, whether it is breathing, or whether it is with sleep, or whether it is with energy level. These are the things and benefits that we're able to provide for people. And so for me, it was kind of different. It was almost like a surreal experience, being able to sit back and watch and see what was developing, the discoveries that people were making, and how it was very much related to the Buteyko method and the principles with the power of breathing. It was very fascinating for me and really exciting. So my experience was a little bit different than others. And plus, I will also speak to this. Even for me, working in that environment, I knew that and understood how to use my breathing to increase my protection, as you had asked about the mask, well, beyond the mask. And that's some of the things I'll be talking about in the webinar, that I was able to deal with clients, patients who had COVID with zero fear, because some of the things and the gifts that I was given through the Buteyko, utilizing the Buteyko method and receiving the Buteyko training, which I tried also passed on to others as well, which we'll talk about in the webinar, things that you can do to help your friends and level of anxiety to a certain degree by utilizing this additional tool for their own protection. And I was able to do that. Worked before, during, and after, and fortunately did not have COVID, but I worked directly with COVID positive patients, not patients that were questionable, but day in and day out, and was right there in their rooms, serving them coffee with a sense of joy, not a sense of fear. And that to me was just a gift that I not only want to continue to give, but that I received as a result of my training. I was able to treat and deal with COVID patients, not with fear, but with the gift of love, caring. For some, it was their last experience in life, because not everyone, and many people did succumb to the COVID-19. So to give them that last gift of human touch, joy without fear, I thought was a gift within itself that I was able to capitalize on, and like to share that experience with others on the webinar.
Are there any other personal stories over the past year? I know 2020 has, I think, been for all of us quite a year, but when you look back and working through COVID-19 at the hospital, any other stories you'd like to share with us?
Well, I would say, if you look at the culture in which we are in right now, there's a level of anxiety, a level of fear because of the unknown. And that's not just in society. That was the state and is the state, on a magnified level within the hospital. And so that does have an impact on our health. And I would say, I've seen how the Buteyko method not only addresses our, breathing, our immune system, but also your level of anxiety. It can have a significant impact. And I've seen it, working with ICU patients, being able to share, as you asked before, some of the tidbits, some of the basics, and seeing right before my eyes within 10 minutes that the patient's countenance changes, the level of anxiety lowers. And so that's another valuable benefit of the things that we are dealing with, addressing, trying to educate people on, because not many things, in life can, have that kind of power. And that's one of the things that Dr. Buteyko gave us as a gift, showing us how powerful our breathing is. And for some, quicker than others. And so that's something that I'd like to share and continue to pass on.
Yeah, I believe I really resonate with what you're saying, and I believe that we have two choices. We can either function from fear or love, and there really is no other choice, right? Even any decision that we're making. I love what you are putting out there, the information that you are giving people to help them through this very uneven time. And you've mentioned a couple of times the webinar coming up. Let's dive into that. It's October 25th. It's 11 a.m. Eastern Time. Learn my personal secrets to protecting against COVID-19. This is a fantastic webinar. I think it's a great opportunity for people who are new to the method and want to apply this method during this season that we are living in, this very long season that we're living in. It's going to be the perfect opportunity for them to join us. Can you tell us a little bit more about that webinar?
Well, during that webinar, I'll be looking to share some, experiences that would be better shared in not a public forum, but really being able to get feedback from others and answer questions. Because it's going to be also a webinar that I'll be sharing my experience, but also open to questions and sharing with people how they can maximize their benefits with this method and work with me. I think it'll be important because, what a lot of times people put information out there and they may hear something on the news or what have you, but you can't interact with the news. You can't ask the news reporter, well, what about this? What questions, questions that may come up. Well, during this webinar, I'd like to share and get some of that feedback and connect with some of the people on the webinar to maybe answer some questions, some related to things related to COVID in the hospital as well as outside the hospital, and how these breathing principles, this Buteyko method, can maximize their benefits. And that, I feel that's best done in sort of like a dialogue type of fashion. And that's what is going to help maximize people's information and being able to utilize this information for not only themselves, for their loved ones, and for having their own impact in addressing, in maybe like a microcosm type aspect of their world, and bringing some, light and positivity and awareness of maybe some things that they can do to potentially protect themselves if they don't have it, and what they can do to potentially improve the recovery or quicken the recovery if they do. And so those are some of the things that I'm excited about during the webinar to share, for those, especially for those who are new to the method, talking about some basic application of, how to use this towards our health.
Yes, the live interaction in and of itself, I think, is going to be so valuable to be able to have that time with you. It's going to allow us to not feel alone, and it's also going to empower us. So that is quite a gift that you are offering, the gift of empowering and from working from love versus fear. And I think this is going to be a fantastic webinar. We're going to put a link to the webinar below this video. Any final thoughts, Fred?
Not so much final, but really just this is just the beginning, because this is a tool that people can plug into and use as a beginning of their own awareness, education, and how they can use this information moving forward, even beyond COVID-19. Because just COVID-19 may have been the catalyst that brought people's attention and awareness, to the importance of their health and, addressing health issues, whether present or preventing future. I think it's just really, if one good thing that we can, and look at an unfortunate circumstance, you can always draw, some positive. And I say that's a very positive. People are a lot more conscious of their health, and they should be. They should have been, but even more so now, now that we're living, in these unprecedented times. So that would be my final thoughts. Thanks for asking that, Terry.
Thanks so much for sharing space with me today, Fred. I'm super excited about this upcoming webinar. Again, check the link below and sign up today. This webinar is free. It is upcoming on Sunday, October 25th, 11 a.m. Thanks, Fred.
Take care. Bye now. See you then.